regard between our fellows. And I think we have not just the opportunity, but the responsibility to provide humanitarian service worldwide.
So come and join the ICD, the International College of Dentists.
Join ICD.
Join ICD.
Join ICD.
Join us at ICD.
Join ICD.
Join the ICD. It's a great organization, and we prosper from your fellowship.
by your kindness and talent, as sharing your commitment to help the whole world smile. By your passion and intention, lend us a hand. No matter who you are, no matter where you come from, there's no big deal for us walking forward together. No matter when you know, no matter what is your pose, there's way to go for us serving to all the people around the world. Sharing your experience that make the whole world smile. By your kindness and talent, as sharing your commitment to help the whole world smile. By your passion and intention, lend us a hand. The whole world smile. By your kindness and talent, as sharing your commitment to help the whole world smile. By your passion and intention, sharing your experience that make the whole world smile. By your kindness and talent, and sharing your commitment to help the whole world smile. By your passion and intention, sharing your experience that make the whole world smile. By your kindness and talent, as sharing your commitment to help the whole world smile. By your passion and intention, lend us a hand. By your passion and intention, lend us a hand. Come to join with us, ICD, give us your hands.
Welcome to our ICD bi-monthly webinar. And tonight we have special topics represented and about hypnosis, hypnodontics. Now I will invite the moderator of this session, Associate Professor Datin Dr. Mayuna, to start the session and introduce the speaker. Datin, the floor is yours. Go ahead.
Good evening, ladies and gentlemen, registrants for the ICD section 15, and dear fellows, welcome for this webinar tonight, 16 March 2022. Tonight we have, Prof, can you see me?
Yeah, okay, go ahead.
Okay, all right. Tonight we have Associate Professor Dr. Annapurny. We'll be talking on the verbal sedation, the art of hypnodontics. Let me read to you the CV of Prof. Associate Prof. Dr. Annapurny. She graduated from the University of Malaya, Kuala Lumpur in 2002. And she completed her clinical master's in pediatric dentistry in 2010, and also obtained a membership of the Faculty of Dental Surgery, England in 2008. She is trained as clinical hypnotherapist and obtained her diploma in hypnotherapy from London College of Clinical Hypnosis in 2015. She has recently completed a PG, postgrad diploma in the field of health economics from the University of South Wales. Dr. Annapurny is currently an associate professor, as I mentioned earlier on, at the Faculty of Dentistry, University Technology, Amara, Malaysia, and is actively involved in the teaching and research. Her area of interest includes dental traumatology, craniofacial anomalies, and hypnosis. She currently holds the position of the Vice President of the Malaysian Association of Pediatric Dentistry. Without any more waste of time, we invite Associate Professor Dr. Anna to present her talk on verbal sedation, the art of hypnodontics. Dr. Anna, the screen is yours.
Hi, good evening, everyone. Can you hear me, Datin?
Yes, very clear.
Okay, thank you so much. It's a real honor to be speaking here at ICD. Let me just get this. Okay. Can you see my slides yet?
Yes. Full screen, please.
Okay. All right.
All right, you're on.
Thank you so much for giving me this opportunity of you regarding a very interesting topic that is close to my heart. So I think some of you may have heard of hypnosis, but it may come as a new thing for many of you. So just give me this 1 hour to see what I can, how much I can hypnotize you tonight. Well, as Datin mentioned just now, I am trained in hypnotherapy. So I'm just going to, I think I would like to start by talking about my journey in hypnotherapy, because it was something that came about quite unexpectedly. So my journey with hypnotherapy actually began with sort of a personal sort of seeking. And that's how I ended up at LCCH. LCCH is the London College of Clinical Hypnotherapy, which actually has a branch here in Malaysia, in KL itself. So once I went in, and when I spoke to some of my friends, some of my colleagues as well had some had some exposure and some basically had attended some talks related to hypnotherapy. So it started. This is not my students falling asleep at my lecture. These are actually participants at a hypnosis class. So basically, I went in to learn a little bit more. And I enrolled in a certificate program, which was over 4 to 5 months, which came with an examination as well. And then I went on to do my diploma in hypnotherapy, clinical hypnotherapy. And with that, and with a lot of support, we were really lucky because there were a few friends. When we started off for the certificate, there were 4 of us. At that point, we were all pediatric dentists, because pediatric dentists actually were very involved in behavior management therapy. So we started off, the 4 of us who went in, with the full support of our faculty and our dean. And I must thank you for that, Professor Dato Muhammad Ibrahim, because he gave us the green light and gave us a lot of encouragement and the financial assistance to attend this hypnotherapy course. So once we came back, again, with the support of the faculty, we started practicing. And I think I was very lucky because I have colleagues who work with me who are doing hypnotherapy. I think to embark on it by myself would have been quite a challenge, but because we work in a team. So in my team, I have Dr. Rohaida with me, and we in pediatric dentistry, and we attend a lot of the cases together. So that sort of gave me a lot of confidence when I was working with a friend. And it's been some time. So, I'm quite blessed because we've also got managed to get out some publication with regards to hypnotherapy. And this is my wonderful team of from the left to right. So we have Dr. Saras, who is an orthodontist who actively practices hypnotherapy here at UITM. Dr. Rohaida, she's a fellow pediatric dentist, and we do a lot of cases together. And next to me there is the lovely Dr. Afzan, who is an endodontist and who has also spoken a lot at conferences and for her experience with patients with hypnotherapy, for endodontic patients. So this has been sort of my journey. It started 2014 with the certificate program. So I'm quite happy to say that we've come quite a long way. And I think in Malaysia, we are the first university with a dedicated hypnotherapy room, hypnotherapy service that is listed as one of our services. And we are starting to get a lot of referrals from dentists and medical practitioners as well. So, oh, I forgot the last part is, this was something recent. I just got elected as a vice president of the Malaysian Society of Clinical Hypnosis. So this is something that is truly something great for us in dentistry, because we want to get it out there. And we are blessed that the Ministry of Health in Malaysia has recognized the role that hypnosis plays. And there's a lot of interest from the Ministry of Health. And we also get a lot of medical practitioners as well as dentists who are sponsored by the Ministry of Health to attend the courses at LCCH. So I'm just going to briefly go through about the history of hypnosis to give you a little bit of background on how it started and how it evolved and became a tool in dentistry and in medicine. And also to see how hypnosis is used in dentistry. I would then like to share some of my cases and just touch a little bit about the future and what is the way forward. So hypnosis is not something new. Okay, it is actually, if you, it has its roots. It has been described Egyptian, Sumerian, Greek culture. In fact, hypnosis is sleep, and they used to have one of the methods of healing in Greek times is actually temple of sleep. And so the reason being that while you are in a suggestible state, and it's easier for you to receive suggestions on healing. So if you go back and read, there's actually a lot of stories that are written, okay, right back to the Greek culture, Sumerian, as well as the Egyptian. And unfortunately, sometimes in modern days, hypnosis is looked upon as being something that is supernatural, but we'll go through to see that actually it has nothing to do with the supernatural. It is actually has got a lot of scientific basis. Okay, so I'm sure all of you have heard the word mesmerism. So it comes from Anton Mesmer, and it's documented in the 18th century. However, at that time, it was introduced as a concept of animal magnetism. So it was postulated that illnesses were actually related to imbalances or disturbances in a tidal flow of animal magnetism in the body. So the way it was sort of put forward, it did challenge, the scientific world did challenge it, and it received a lot of backlash. But in reality, this is where the concept was also seen for the first time in the sort of the modern world. And then we had James Bray, a Scottish surgeon, and he's known as the father of modern hypnotism. So he was able to sort of describe it and saying that people are in a highly suggestible state. And this is the best time to actually, we will go through this. You will hear the word suggestions and suggestive during hypnotic trance. Okay, and so basically after Braid, we saw that hypnosis it did take a step back, and because there's I think understandably there was a lot of skepticism around it. However, during the World Wars, the First World War, Second World War, when there was not enough medicine, there's not enough supply, there's no anesthetic agents. So hypnosis was actually used for the soldiers who sustained multiple trauma. And this has also been well documented that hypnosis was capable and was used in the field during the war. So basically, the hypnosis techniques that we use today, a lot of it goes back to the work of Milton Erickson. And Erickson is actually a psychiatrist, but he had a very, very good flair for languages. So Erickson used a lot of metaphors. So you will see, if you Google or you try to listen to some hypnosis scripts, you will hear, a likening to something like, oh, when you walk through the garden, clear the garden, plant new seeds. So it doesn't literally mean seeds, but it's very metaphorical. So that would probably resonate with something like moving all the bad bad energy out. Let's start afresh. Start with positive thoughts. So that means he doesn't use direct language. He uses metaphors. And that is very, very common in the scripts that we use. Even in dentistry, we use a lot of metaphors. And being a pediatric dentist, this works very well with the way or the language that we use with the children. So for those of us who use nitrous oxide, we actually speak to the patients as such as well. So I think because of that, it was quite easy for us as pediatric dentists to pick up this hypnotic language. So what is hypnosis? To be honest, all of us have been in hypnosis before. So hypnosis is a state. And basically, it is a state that occurs naturally. Hypnotherapy is where we actually work on it and we use it for medical or, for the purpose of healing. But hypnosis itself, just imagine yourself driving to work. You get into the car, you switch on your radio, you drive to work. And basically, you don't have to think about where you need to turn. In fact, if I leave my house early in the morning, it's almost every time, even though I'm on leave and going somewhere else, I always have this tendency of almost turning into the road where I'm headed for work. It's because it's already in our mind. It's in our subconscious mind. So our conscious mind is basically something that is very busy. Our conscious mind is very logical. It's bombarded with things that we need to do. Which has requires our attention, but a lot of things actually happen automatically. And it's basically like having a desktop, and you put all the important things on your desktop, but everything else, all your digital footprint is still in the computer, it's still in the hard drive. So that's, I suppose, a good analogy to see that we actually have a certain few things that we put up that is important or we are focused on, but everything else actually just plays automatically in the back. Okay, so basically in hypnosis, we are trying to actually work with the subconscious mind. So if one of it is driving, or one of it is when you're reading a book and you feel immersed in the book, you feel like you're one of the characters, you're watching a movie. And some of us, especially ladies, we are so good at multitasking. We'd be ironing our clothes, watching a drama serial, fully immersed, but, being able to complete our task as well. So this is it's a state of hypnosis as well. And so it happens, it can happen in our daily lives. And I think some of us, I don't know, I'm a daydreamer. So some of you who've had that experience before of daydreaming, it's something like that. Sometimes I'm driving and I listen to a song. I think I'm singing the song. So I see a picture of myself on stage. So that is actually hypnosis as well. It's us imagining ourselves achieving something. So as I said, the conscious mind is just the tip of the iceberg. So basically, there's so much. Everything that we have gone through, everything that we have studied, every experience that we have had, all of that is actually embedded in the unconscious mind. So basically, what this means is this explains why some of our patients come in not wanting to be anxious about dental treatment, but they already come and they don't even know why they're anxious, but they have that feeling. Okay, it's something that is out of their control. So what is a hypnotic suggestion? So it is a communication which is given verbally by the operator or the hypnotherapist that directs your patient's imagination in order to have an alteration in the sensation, perception, feeling, thoughts, or behavior. So basically, when a patient walks in, and I'm sure many of us have had this, because I think dentistry is a fear machine, it's a fear factory. I think most people, there's evidence that shows that 30% of the population have dental anxiety, and this number has not changed from the early 1900s till now. So why is it so? So many reasons why people are anxious to have dental treatment. So basically, by having this hypnotic suggestion, we could help our patients. Okay. Another way to try to imagine what it is. So our brains have different waves. And so when we go through different cycles during the day, okay, so when we are having activity, we have the gamma waves and the beta waves are when we are really busy, engaged in activities. Okay, once we start to relax, so you have your alpha waves and the theta waves setting in. So this is a point where you're really relaxed. Some people say it's the same like when you're meditating. Okay, and another very common time for us to have this increased, like heightened suggestibility is theta wave, is just when you're about to fall asleep or just as you're waking up. So these are the times. Sometimes I'm sure some of you have experienced feeling light, feeling, like, oh yeah, I feel like I'm slightly floating just before falling asleep or just when you're waking up. So these are the times. So alpha wave and theta wave. So hypnosis actually is basically getting you into this state so that we can work with the unconscious mind. So what can it feel like? It feels like what I said, dreamy, floating, sleepy, feeling a little tipsy and happy. So that these are what patients have described it as. So what can you experience when you have hypnosis? I tend to use it quite commonly because I want my patients to come in and feel comfortable. So because I use hypnotic language, it comes naturally because we've been practicing it for so long. So sometimes when my patient come, they sit on the chair and, we sometimes I just offer to get them into a relaxed situation. And they would come out telling me, oh yeah, I don't know why I felt I was in Legoland, So they can basically feel that they are somewhere that it's a favorite place for them, somewhere where it's fun. Sometimes they see themselves, they imagine themselves, in a future event, being positive. So in dentistry, we like to encourage them. Sometimes before we do treatment and we know that the patient is quite anxious, we get them to have this pseudo orientation in time or to imagine themselves coming for a dental appointment and feeling good about themselves. So basically, that tends to work as well. With a lot of my patients, they are all into games. They are a lot into like games. They're on their phones and things like that. So basically, what we have done is we use their game. So when they're really relaxed and they're having dental treatment, they're actually in a game. So it's very important for us to know what the patient's interest is. It's important to ask them what games they play. And I think for a lot of us, like for me, I had to look, I never knew about these games. So I had to Google, look up the games, learn about the characters. So it really helped me in guiding the patients into their hypnosis. And basically, we also use some regression techniques sometimes to go back to the event where it has caused trauma for the patient, and resulting in them having this dental anxiety. So we'll go through some of the methods, and we'll see some of the cases that we've done as well, and we can have a look at the techniques. So in terms with children, they are in hypnosis. It's very easy to get children into a hypnotic state because they're, as you know, young children are quite imaginative. So sometimes, when you turn around, even when you get them into a relaxed mode, saying, you're on a paradise island now. Can you see this big giraffe? Can you see a unicorn? And they will say, yes, I can see a unicorn. So it's easier to sort of get children into a hypnotic state. However, one thing would be their cognition. So if they are not at an age where they're able to communicate with you, because we're using a lot of words. So if they are not in that sort of cognition of being able to understand the language, or sometimes perhaps with certain groups of special needs patients who are nonverbal, then it might be a challenge. So we may not be able to use that. However, with some of the high functioning autistic children, we've had really, really interesting sessions with them, because they tend to understand the language, and they sort of can respond well to hypnosis. So the difference in hypnosis between children and adults is that usually in adults, we get them to close their eyes. So I'll show you later what are the steps in hypnosis. So one of the steps is actually induction. And usually at induction, we get the adults to close their eyes, because when you're at rest, you need to close your eyes. That's when you can get into a state of hypnosis. But with children, they can be in a hypnotic trance. The word is trance when they're in hypnosis. They can be in a hypnotic trance, but have their eyes open. So later I'll tell you a funny story about how I did not realize one of my patients was actually in hypnosis. So I think it's with children, and they're starting out, they've not had a bad experience. I think it will be a good step to start them off, to make them feel that dental treatment can be a relaxed affair. It's not something that is nothing for them to be highly anxious or afraid of. So with children, we use a lot of stories, imaginary friends that they may have. They bring in their, they will bring in their toys. So we use that. In adults, I can say that actually a lot of adults are now coming in seeking hypnosis, because a lot of adults come in with a lot of issues, a lot of problems. And, of course, like things like COVID, the pandemic that has happened, lots of people have lots of issues. And when they come in, sometimes when they are displaying some anxiety, it may not directly be related to dentistry, because they're dealing a lot in life. So some of them who come in, I had one patient who was referred to me for gag reflex. And this gag reflex, he's, I think, 30 plus, and he never had a gag reflex before. And it developed very, very recently. And because he was going through a lot of things in life. So, at least hypnosis was there. We managed to work with him. And his issue had nothing to do with dentistry. It was totally something different. So sometimes it's important as well to deal. It may not be a direct dental issue, but it manifests as a problem. So the gag reflex definitely was a problem for the dentist. So a lot of other issues can affect treatment of a patient. So it's quite interesting, because I've seen so many cases that goes back to other reasons. Abuse, being bullied in school, lots of things. Unhappy with their body weight, lots of things that actually can lead to anxiety. And I see it more commonly in teenagers. in teenagers, a lot of the teenagers who are coming in now have a lot of issues that they deal with, and it's actually quite it's nice to know that we can help them with hypnosis. So as you know, as I told you, dentistry, fear machine. We generate a lot of fear, and of course, a lot of anxiety. So there's a distinct sort of difference between fear, anxiety, and phobia. So you will see that in your patients, like in children, they just start screaming on the chair. They jump off your chair. Some of them will punch you. You know, a lot of we deal with a lot of that. But with adults, they're unable to react in such a manner. But you will see, like a lot of these patients, they will be an avoidance pattern, or the patient will be on your chair, and every time you want to do something, they keep on talking, they keep on asking you questions. Sometimes it's actually an avoidance behavior. They're trying to sort of delay you with your treatment. Another thing you will see is last minute cancellation. They will come up with lots of reasons on why they can't show up for the appointment. So this is really, it's a vicious cycle, and because you're anxious and then you have this avoidance pattern, your dental problem gets worse. The treatment need becomes greater, which means that probably the procedure to be done becomes more complex, and that in turn increases your anxiety. So this vicious cycle needs to be broken. So we see this with a lot of our adults. We see it with a lot of avoidance behavior and trying to delay treatment. So this is something, if we pick up in our patients, I think it is quite worth it to get then referred for hypnosis. So the good thing about hypnosis, non-pharmacological. You don't require special tools. You can do it anywhere. So that's why I call it a verbal sedation. When I was thinking about a title for today's talk, I thought to myself, why not verbal sedation? Because I've been working with these patients, and some when I look at my patients who are in trance, hypnotic trance, I'm seeing a very, very similar response of when I put them under nitrous oxide. So if that's inhalational sedation and I'm getting that result, why not call this verbal sedation? Because pretty similar. You see the changes in the patient as they're going deeper and deeper into hypnosis. You see the kind of response that we are taught to monitor in nitrous oxide sedation. So how we've got our postgraduates who are trained as well in hypnosis. And I remember what I used to do, because we used to start it off with nitrous oxide and the hypnosis. And then I would quietly turn back 100% oxygen for the patient. And the patient was actually still in basically sedated and needed to be awakened from the hypnosis. So sometimes I started off with both. I use a lot of nitrous oxide and hypnosis as an adjunct, but what I do is I actually switch off and deliver 100% oxygen, and you see that the effects carry on until the end of treatment. And the good thing about hypnosis, it's not just about dealing with the treatment at that point. Because it works on your unconscious or subconscious mind, it can be used to instill positive behavior. Meaning, if a patient needed extra care, just say they're going for orthodontic treatment, and needed to maintain good oral hygiene. So there's actually been some good studies. There's one nice paper talking about how they increase the efficiency of wearing intraoral appliances. So basically, it's sort of a motivation, because we try to motivate our patients, but how good are they at practicing it at home? So by using hypnosis, actually you can instill a positive behavior. So it's not like they are sort of they are reminded. It becomes a habit. So instilling good habit can actually also be achieved by using hypnosis. So that's why the changes can be more long lasting. So we see it in oral hygiene maintenance. So we see it also in wearing intraoral appliances. So it's very good. So what do we use it for in dentistry? Definitely. So there's a lot of work in hypnosis for pain management for any medical conditions. So similarly, we can use it for pain management in dentistry. And of course, getting an anxious patient to receive treatment. Gag reflex is something that is actually very, very good for us to reduce salivation during treatment. Okay, habit breakers, so thumb sucking, nail biting, bruxism. Basically, there's a lot of scripts for snoring and things like that as well. So very good for habit breakers. And as I mentioned earlier, to increase patient motivation. Also can be used for to quit smoking. So because as dentists as well, we need to promote cessation of smoking. So this is a very good tool that can be used as well. So how is it done? Not mumbo jumbo, no trickeries involved. Okay, so as I said, we have a dedicated room in our faculty. So sometimes we work with our patients in the dedicated room. If they're very highly anxious about dental setting, sometimes we sort of work with them in a separate room first before we start the dental treatment, or probably the next appointment would be the treatment. And the other thing is just chairside. So in a lot of cases, that on the right-hand side, there's Dr. Rohaida doing her script. A lot of cases, we do it chairside. So one of us would be the operator and the other person would be doing the hypnosis. So that, you know, we don't get, I think it's quite difficult sometimes to do your dental work as well as the hypnosis, but it is possible. But because we have a team, so usually we work in pairs. So when I'm the operator, usually Dr. Roheda will come in and do the hypnosis. And sometimes when we do hypnosis combined with nitrous oxide, usually she will control both. She'll control the nitrous oxide and the hypnosis as well. Another good way, which we find, is actually recordings. So you can send this hypnosis recordings, the scripts, to your patients, so they can listen at home. There's some interesting studies on that as well by using this audio. That means you listen to the audio. Some of them play it in the car, so you listen to this audio before you come. So it can be given to them before the appointment. So these are the various ways in where and how we can practice hypnosis. So the therapy room, most of the time, the therapy room, I use it for adults. I have used it for children who wanted to speak without the presence of their parents. Usually the teenagers, you know, when they're having some issues in school and they don't want their parents to listen in that. So children, mostly we use it chairside. Most often we use it chairside, but you know, the treatment goes on as usual. Everyone is there. Your assistant is there. We just sort of weave in and do the hypnosis. So far, it's been working well. But for some sensitive cases, you know, and we would probably deal with them in the therapy room first. I don't have anyone else in there, so there's privacy for the patient. And usually for hypnosis, although it is listed as one of the treatments services provided by us, we keep our records separately because you know, sometimes these are confidential information, personal information. We have an online patient information system, but we have a separate sort of filing for these notes. We don't usually put them up because these are sensitive information. So I told you that there are stages of hypnosis, okay? So usually we start with, just like how we do dental treatment, there needs to be some sort of END kind of thing. So in the introduction, we want to know what is the patient's past experience. You know, we want to know whether the patient has any medical problems as well, because some of the techniques that we use, for example, by, you know, moving the eye, you know, so by using some quick eye movement, if the patient has some eye issue, we would try to avoid that. And if the patient already has depression, we would avoid using certain suggestions or words like low. I know that it doesn't help with patients who have depression. So we are taught there's actually a syllabus, and we are taught to assess our patients so that we know what is suitable and what should be avoided, what techniques should be avoided for some of these patients. So, and it's also important to have goal setting. So what is it we want to achieve? So in hypnosis, it's also it's a new concept for many of you. So you can imagine that some of the patients' parents go like, what are you doing? What is this? So at this stage, we need to explain. We need to talk to the parents and tell them, explain what hypnosis is. You have to dispel any myth that is there. So we need to talk to parents. We can't just spring in and do something, and the parents will get quite shocked. So during this session, we explain to them, and then of course we ask them for their permission to conduct the hypnotherapy session. And then comes the induction. So induction with children, sometimes we just do a countdown. We can ask them to close their eyes, but they may not necessarily close their eyes. So you ask them to count down. Deepener is to get them further into relaxation. So an example would be going down the stairs, you're counting, you're holding on to the rail, you're counting down from 10 to 1. You'll say with every step, you feel deeper and deeper relaxed. So that's how the sort of script goes. So usually with the children I work with, I like to let them sort of induction is very fast, and then I get them to count down. I will count down with them 10 to 1, and then I will say, okay, by the time you reach the last step, usually they're coming down the stairs. At the end of the stairs, you will step out and you will see a door. And when you open the door, you will be, for example, I have a patient who loves watching YouTube channels. So I may suggest to the patient, okay, now you walk into the room, there's a huge screen, and you have the remote with you, and you can, switch on any YouTube show you want. So that particular patient liked watching YouTube on cats. So during the session, so when you're working on her, there's still feedback. I will still talk to the patient, are you okay? And the patient will say yes, or put up, thumbs up. And basically that's how it goes on. So, and during this time, when we have a post-hypnotic suggestions, so we usually have our scripts, or when I'm working with the patient, I would say something like, okay, now you're going into another level. You have now graduated from this level, going into the next level in your game. So that's how we sort of proceed. And during post-hypnotic suggestion is when you want to instill. So sometimes I will include, motivational sort of motivational script to tell them that, okay, after this, you'll be able to take care of your oral hygiene, you brush well. So sometimes we sort of put that in during the post-hypnotic suggestion. Awakening is we'll count up from 1 to 10. Counting up from 1 to 10, by the count of 6, you'll start opening your eyes. Count of 8, your eyes will be fully open. By 10, you are fully wide awake. So interestingly, sometimes you have to do the awakening a couple of times for the patients. So sometimes when I'm doing hypnosis, because the child's eyes are open, it doesn't look like they are in trance. So sometimes the observer may think, yeah, Anna says she's doing hypnosis, but the child is just awake. So sometimes when it comes to awakening, you find that the child is still very, very relaxed. And then you see, you have to awaken them 2 or 3 times. And sometimes when you awaken them, that means they're really fully back. And then when you ask them, and then they'll tell you, oh, but yeah, I was playing in the park. I was having so much of fun. So it's these kind of experiences that we have. So sometimes it doesn't look like there's anything major happening. But thankfully, a lot of these sessions have been very successful. So that's how you know that actually they have been in trance, because they'll come up and say, yeah, I was actually really relaxed. I was doing this, I saw that. So homework is sometimes when we give them a task, if they're coming back and having another session with us and things like that. So these are some of the techniques. Dissociation is basically you come out and you can see yourself as a third person. So my experience with this is that I've had a patient who was very, very anxious on the chair. And so I worked with her before coming back for her dental treatment. So I got her to kind of see herself. That means I needed her to dissociate and see herself on the chair and having a pleasant experience, and imagining herself to have a successful treatment, because the girl really wanted dental treatment, but she was every time we tried to approach her on the chair, she would just squirm. She would squirm, turn around, and we are still working with that patient. Sometimes it takes a few visits. I can't really say exactly how many visits per patient. It's quite subjective. Some of them after day one is like immediately you see the change. Some of them it takes a bit longer. Those who take a bit longer usually have an underlying issue. They have some underlying issue that sometimes only pops up during the second or third visit. And usually it's non-dental related. It's something to do with the family, something to do with relationships and other things. So this is, it helps you prepare yourself. It helps you look at yourself in a positive situation. So this is a technique that is used a lot, and there are a lot of available scripts for this technique as well in dentistry. I love this. This is called parts therapy. For those of you who have watched this movie, so this is movie where they explore all the different parts that we have in us. We have sadness, we have joy, we have fear, we have disgust, we have anger. So sometimes, we as dentists or as parents, we keep telling our children, oh, you don't be scared of this, grow up, you're a big girl now, you're a big boy, you shouldn't be afraid. So it becomes an internal turmoil for them as well. They find it difficult to overcome the situation. And so sometimes I've got one patient, I will show you later, we have to deal with this and say that, okay, now I'm going to bring that part of you that is that fear. I'm going to bring that part fear out. I want you to acknowledge that fear is trying to do good things for you. So you need to thank the fear, because what I would tell the patient is, if you didn't have fear, you would walk to the edge of a cliff and just fall off because you didn't have fear. So fear has a role to play in your life. It's just that fear is in overdrive now. So how do we deal with fear? We say, thank you, fear. Thank you for taking care of me. But now I need you to understand that this is not a dangerous situation, and I would like to have dental treatment. As obscure as that sounds, it can actually work. So it's us. We need to acknowledge for the child, tell them that, look, it's okay to have fear. Not only children, I think a lot of adults find it embarrassing that they come to a dental clinic and they're anxious. So I think the first thing to say, and then they come with this embarrassment, saying that, oh no, I'm an adult and yet I have this fear. So a very, very good way to actually deal with it is to deal with this part that is in you, saying, thank you. You are actually serving a purpose, but I need you to sort of take a chill pill and, let me go through with the treatment. And so this is also quite an interesting technique. I have used this, and this has been quite good as well. Pseudo orientation in time is imagining that you, at the end of the treatment, you've got this nice teeth, is looking good, you've reached your goal. So that's also a very good technique. Regression, to go back probably to visit the reason. You could have been a 3-year-old held down for, and probably it had to be done. Probably the 3-year-old had a trauma and there's no other way rather than to hold the patient down. But they can actually come. Those kind of memories, even though the patient may not recall it in full, may have an impact on the unconscious mind. So we probably need to deal with that. So that's what we use regression for. Anchoring is we anchor. That means if we know, okay, if I'm going to the dental clinic, I'm going to get my teeth scaled. It really, it makes me really fuzzy. What we do is we install an anchor. That means the patient may, like put their fingers together, or, they may do this or something. They will choose what anchor they have. So when they're in this anxious situation, they will activate the anchor. And so when the anchor is activated, they become more relaxed. So that is possible with hypnosis as well. Desensitization also is a technique we kind of grade what is their fear. So we give it a scale. You can give it 1 to 5, 1 to 10, 0 to 100, whatever you want, and scale. Give them, rank it. Me getting into the car, going to the dental clinic, I have like my fear is 20. Probably the worst is getting the injection. My fear is 100, and opening the door and seeing the doctor with a white coat, 50. So what we do is we rank it. So what we do is we work with the lowest first. We slowly eliminate, work with the lower level, get that done. Okay, now you don't have anxiety when you get into the car to go to the dental clinic. Then the next one we remove is, okay, seeing the dentist. So that's how we sort of work incrementally. Okay, are there any laws? Not really. I think the only one I've come across is in Brazil, but where they stipulate how many hours of training that you need to have. However, there's professional indemnity insurance, and in Malaysia as well, although there are no laws per se, but we do have groups that we can sort of go to, and there's a lot of work being done to come out, not really with rules and regulations, but as reference. Okay, as I said, and just sharing some cases with you. As I said, I use it a lot as an adjunct to nitrous oxide sedation. So I find that we need less inhalational gas. Sometimes I use it as a placebo. I use it just at induction, and then I switch it back to 100%. And usually the following session, we don't even need nitrous oxide. So we can use hypnosis straight away. So I had to learn about this game called Mobile Legend, because a lot of my patients apparently play this game. So I use this a lot in my scripts, in my inductions, and I tell the patients that they're going into Mobile Legend. They can become the avatar that they want. They are given coins so that they can, So this works pretty well. So we've had to learn, my colleagues and I have had to learn a lot about these games as well. So this, I attempted an extraction for the patient with nitrous oxide. It didn't work. Patient pulled off the nasal hood. But when we coupled it with nitrous oxide with hypnosis, it was successful. So sometimes nitrous oxide by itself, if the patient is really anxious and pulls off their hood, there's nothing we can do about it. It's not every single nitrous oxide is going to be successful if the patient is really that anxious. So when hypnosis comes in, sometimes we get to do the treatment. So this is the patient that had needle phobia. I use a desensitization as well as addressing the fear in her. And this patient, she's 14 years old. The mother said that whenever they would try to do and she needed an RCT, and whenever she even saw the needle, or the needle was in the table, not even prepared yet, she would scream hysterically. Everyone in the clinic could hear her. So the mother was actually quite traumatized with this. And so thankfully, with hypnosis, we managed to, she's now able to receive a treatment with a dental injection with a block. And basically, I had to use two techniques. One of it is this parts therapy, as well as the desensitization. So mother was really happy because, it's a teenager, and she was having a lot of difficulties with the girl. Okay, this is also a favorite case of mine. It's a 13-year-old boy with very, very severe gag reflex. So he needed upper anterior, he needed URA, removable appliance, to correct his crossbite. It was a simple case of removable appliance to correct the crossbite. However, it was so difficult. So this patient was being treated by the student, and they could not insert anything in his mouth, trying to put in a mirror towards the posterior teeth, and that's it, he would gag. They tried to take a lower impression, he threw up. So it was really bad. So a lot of issues there. Number one was to get a proper impression. That was going to be an issue. Secondly, how is he going to tolerate wearing a URA if he's got such bad gag reflex? Then the mother told me that he has a problem with swallowing tablets as well. He cannot take medication which are in tablet form. So we said, okay, we'll try hypnosis. I've got a little video here just to share. So this is actually, but this is all pre-COVID days. So please don't ask me why they're not in full PPE. This is pre-COVID days. So my colleague here, Dr. Inda, she's the orthodontist. And so she was supervising the case, and it was basically impossible to get his impressions. So what you're going to see now is I've already put him under hypnotic trance. So what technique I used with him is I told him this is called a glove anesthesia. So I empowered his hand. I told him that he's got a special glove on his hand. And he's a very bright boy. He decided that his glove was going to be the glove of Thanos, if you watch Avengers. So he said he's got the glove of Thanos. So you will hear me say Thanos. I'm sorry, I spoke to him in Bahasa Malaysia, so some of you may not understand what I'm saying, but I've just written some things like a caption down there. So let's just have a look at the video.
Okey, Amir boleh buka mulut sekarang. Kita akan mengambil acuan gigi bawah dan Amir akan berasa selesa. Tak ada apa-apa yang mengacau. Kalau ada, kita ada tangan Thanos. Dan okey, Amir bernafas dalam, bernafas.
So as you can see, what he did with his Thanos hand is, I told him that this glove anesthesia, that means whenever he uses his finger to touch any part of his face or mouth, it would anesthetize that area. So in his mind, he was, starting to feel, he was starting to have that gag reflex. But what he did, if you notice in the video, he kept putting his finger in. So what he was doing is he was effectively numbing that area. So you could see him, his eyes were closed. He was a teenager. He was, his eyes are closed. He was in a hypnotic trance. So before the hypnosis, we basically couldn't even put in the mirror to the posterior teeth. That was how bad the gag reflex was. And amazingly, after that, when he came back, the mother told me that he is now able to take oral medication. He's able to swallow tablets as well. And he's now being seen by a postgraduate student to do his URA, and he's perfectly fine now. So he doesn't require any further hypnotherapy. So basically he knows that he can numb the area whenever he wants. Okay. We've also worked with patients, sometimes we have, I have one patient with delayed cleft lip and palate repair, having lots of issues because being bullied at school, very low self-esteem. So I've been working with her and she needed to go through a major surgery. So basically we've been working with her to improve that. And I think it's really, sometimes it's not just the patients, it's also their parents who need a lot of motivation, patients who undergo multiple surgeries for cleft lip and palate. They go through so much. So sometimes it's really, really nice to be able to support them with that motivation as well. Also, another case I had was a 15-year-old boy who sustained dentoalveolar trauma, did not get treatment for 2 days. This boy was highly anxious, did not get treatment for 2 days. By the time it came to us, basically, we needed to sort that out. We needed to reposition the teeth. There was a lot of soft tissue and dental alveolar damage as well. So we did use nitrous oxide, but we combined it with hypnosis because he was really, really very anxious. And, it was at a time where it's not easy to get GA. It was also the start of the pandemic, not easy to get GA. So basically, we've been managing this boy. So whenever he needs any surgical intervention, we usually use hypnosis for him. He was really highly anxious to the point that they avoided treatment for 2 days. And another child, also, this was a case that was seen privately. And when it came to us, the patient also very highly anxious and needed to remove the arch bar and was planned for removal under GA at the private hospital. So, but we managed to do it. And this is my funny story because I put the patient into hypnosis, or I thought I was doing it, but this patient's eyes were open. He was still talking to me. And by the end of the session, basically when the operator was done with him, because I took him into his room where he could play games. And at the end of the session, he asked, where's the door? Can I leave? Can I leave now? So basically, he was still in hypnosis. He didn't appear to be, but that's why I said the power of hypnosis is actually quite good. And he was very anxious, was supposed to be done under GA, but they managed to remove the arch bar for him. And he was really, really good on the chair as well. And he was really relaxed. So these are some of the cases, many, many, many more cases that we have done. I can't share all of them, but I'm hoping that in the Q&A, I think the best way for us the best way is for me to address your questions, because I'm sure you have lots of questions regarding this. So in short, I think basically I'm still learning. And we are documenting, we're collecting the cases, we document, sometimes we sit down, we discuss, we write them down, because with every case, I'm learning something from it. Some of the challenges you may have, basically you need proper training. So it's not something, not like you listen to my talk today, tomorrow you're going to start hypnosis. Unfortunately, there's training that comes along that, and so basically, for those of you who are interested, I think it's a route really worth walking down, and I have no regrets. I'm really, really happy that I've sort of done this. And I think the way forward is to have more research, and we need to encourage more publications in this area. Not many papers are out there. People are using it, and the problem is, I think people in isolation, they're using it by themselves. So there needs to be more research, and hopefully there are more people who will take an interest in this. There are some papers out there which outline how we could do research. And I think the main thing about research in hypnosis is finding the tool for measurement. Doing the hypnosis is one thing, but how are we going to measure it? Is it biofeedback? Is it questionnaire for the patients and how they feel? So we need to sort of standardize this. So there's a lot of scope in terms of research in hypnosis. Okay, the way forward is definitely to have training. And we have a center here. We have a LCCH Asia. So basically, one of the I would say probably go for the training, start with a certificate and go for an advanced. And secondly, I would say to introduce this in our syllabus. We are quite lucky because at UiTM, it is part of the syllabus for our postgraduate training. And we also do show our undergraduates, and we do expose them to this behavior management technique as well. And as I said, we need to really pump it in where it comes to research, and we need to be sharing our findings. We need to publish, and probably the best way for us. Well, there are lots of books out there. And I get a lot of my scripts actually online as well. So there's a lot of resources, and we share. And I basically do a lot of my scripts by myself because some of my patients prefer them in Bahasa Malaysia, and I tend to use modified scripts and translate them as well. So I would love to hear from all of you, because I hope I've managed to at least give you a basic introduction. Okay. Datin, back to you.
All right. Wait, and show my face. Okay. All right, Anna, thank you very much for a very interesting, enlightening talk. And before I go on with the question, there are quite a number of congratulations for you for your appointment as an associate professor. Okay, and I do notice so that there are quite a number of participants from Cambodia, because I'm doing the registration, the attendance, and I find it a hard time typing, looking at the names and having to mention it, I presume. Okay, and thank you very much for all the Cambodians and all the participants for being here tonight. Let me start with not a question, but a suggestion. Anna, please consider me as one of your patients and you as my hypnotist, because I have got probably an implant or a bridge to be done by Dr. Marati. Okay, appointment. Appointment. Okay, we have question from, wait, let me see. Let's go with the question first. Okay, this is from Dr. Hon, okay, I presume from Cambodia. Can you do that snap finger thing and the patient instantly go to sleep, like all those magicians do? Is it real or staged? Over to you.
All right. So there is a difference between stage hypnosis and medical hypnosis. But with the snap or saying a certain word, it's with the patient's agreement. So to the question whether you can use a snap, if we have set it with the patient, meaning the patient has come to us and said that I'm very anxious, and then needs to come for repeated endo treatment. Okay, so sometimes like how I mentioned anchoring or something like that. If the patient says, okay, while I'm having my endo treatment, when you keep snapping, I will go like deeper into hypnosis. Yes, it can be done, but not in the way of a stage hypnosis. That means what I forgot to mention in my talk is that we cannot, I cannot ask the patient to do something that they don't want to. Meaning, I cannot ask you for your, I cannot ask you for your account number, or neither can I ask you put a negative suggestion. I cannot put a negative suggestion into you. So basically, you are still aware. It's just that you have given your consent as well to be, because you want to be in this relaxed situation. So if in your hypnosis and in your therapy, you have made a certain sort of like an anchor or a marker to say that every time I am talking to you and every time I do this, you will be more relaxed. Yes, it can work. It can work, but it comes with a prior setting. That means you don't have to be worried that a patient who has got no, we've not worked with the patient with hypnosis, sits on your chair and you do this, nothing's going to happen. The patient's just going to look at us and say, you're crazy. But if it was an agreement, you have installed this during your hypnotherapy with the patient, yes, you can use to, okay, every time I do this, you will be deeper and deeper relaxed. Yes, we can use it as one of the things. But as I said, with the permission and with the consent of the patient that we have set it. I hope
you have to.
I can't get my boss to give me a raise. No.
Yeah. Okay. Or you must have that. That capability. All right. We have question from Dr. Shan. Could you please tell us a little about the use of hypnosis to manage chronic orofacial pain condition? Example, PMD.
Yes. Okay. Actually, this is something that we want to get into. I know I've spoken to Prof. Nobu as well that we want to start something. We have in our team, I mean, like at LCCH and all in our team, we have an anesthetist, Dr. Anand, who works a lot with pain. And he has also approached me saying that he wants to work with the dental team. So definitely it can be used for TMD. Post-op pain, patients, palliative patients, definitely for pain management. So TMD is an area, and actually there are available resources and scripts for this. We haven't gone, we haven't had the time to sort of go deeper into this, but we've spoken actually to the anesthetists at HUITM as well, because they have a pain clinic. So we are actually thinking of having a collaboration. The resources are there, Dr. Shan, and definitely there's evidence as well to show that it can be used. So I think this is an area that we should be exploring. Yes.
Yeah. Okay. We have from Dr. Sofanari Kong. Thank you, Prof, for the very interesting presentation and information. Do you use induction for every appointment or only for difficult patients?
The induction, meaning the hypnosis induction, I use for every case. That means because it has this, it has a flow. It has a flow from the induction right up back to the awakening. So that's a flow that I follow for all the sessions. And the patients are also used to that. They know that, okay, I'm going to start by asking them to close their eyes or do something or fix their gaze on the wall. So,
so that's like the process.
Yeah.
We have a question from an anonymous. Hi, AP Dr. Anand. Thank you for great sharing. Very interesting. In a patient who is skeptic towards hypnotherapy, would it work? And how would you manage them?
So I think for someone who's really skeptical, that introduction part really plays a big thing. If somebody's going to show up at your clinic and say, I'm going to prove you wrong, this doesn't work, it won't work because the patient is not, it's not a willing patient. So it's basically just like nitrous oxide. We use it on a patient who wants treatment but is anxious, not someone who is, you bring them, screaming in and then you gag them down. It doesn't work as well because they'll pull it off. So usually in hypnosis, there is also a test, are you hypnotizable? So there are some sort of test that can be done. But if you read and, through our classes, we believe that sometimes the more you resist, the easier you get into trance as well. So I suppose I won't try to get into this argument with the patient. If the patient says, I'm going to prove you wrong, I know this thing doesn't exist, probably then hypnosis is not going to be my choice of treatment because it's not something that the patient is comfortable with. I'm not going to force it on them. So there has to be some willingness as well. Of course, when you're skeptical, then it falls back to us to explain. Sometimes they are worried because they think it's the only thing that they have is stage hypnosis. Of course, it frightens them. They say, am I going to do something silly when she puts me under hypnosis? So I think that we need to address their fear. We need to address their questions. And I think that first part, that introduction, dispelling the myth about what hypnosis is. That's why when we are trained to do hypnosis, we spend, I think the initial part is just spent on, how we are going to explain. We need to understand it so that we can explain to the patients as well. So if somebody's going to come in there and say that I refuse, then I'm not going to do it. So most often they say, okay, I'm going to try. So I'll say, okay, never mind. I'm just going to just going to count down. You close your eyes. I'll wake you up immediately so that you just want to know what the feeling is. And sometimes what I do is when they're worried, so if they have someone with them, their spouse or someone with them, I say, okay, you sit in together so that you don't feel afraid, They're afraid if they close their eyes and they don't know what's happening to them. So I encourage them to have someone like a chaperone in with them so that most often when we do it for the children, the parents come and ask us, can you do it for us? That's what's been happening to us in dentistry, because parents then ask us. So I know Dr. Rohaida, she gets a lot of requests from parents to do it on them. So because they just, parents, adults have lots of anxiety. So when they see their child, they listen in. So we've seen when sometimes they'll be sitting with their child, the parent is also in hypnosis. Happens to us all the time. So I think it's very important how we explain to them.
We have a question from Dr. Milindra. We have a lot more questions in the chat box, but let me finish with the Q&A part in the Q&A section. Dr. Milan Rajan asked, is there a gadget or any instrument which can be used to make the concentration focus so that patient goes in trance or hypnotic state in a few minutes?
Okay. Sometimes you've seen that they use like a pulsating, like some sound or something like that. But usually it's quite easy. If once they've tried it, just ask them to close their eyes. It's gadgets. You've seen like pendulum and things like that. Usually it's just basically to get our focus. Sometimes it can be something like a black dot on our wall. Sometimes I ask the patient, okay, look straight, just focus on that black dot on the wall. Good enough. So you don't need any fancy gadgets, pulsating machines, or light emitting. You don't really need that because it's really focus of attention. So sometimes it's just like, okay, just focus on my finger, focus on the wall. Sometimes we just put an X mark on the wall and say, okay, just focus on that. So very simple, cheap things that you don't need any gadgets. I've not used any particular gadgets for induction or, yeah.
Okay, Dr. Milan also continue with, does hypnosis works in differently able children? Able children.
So I was saying, I think it comes back to the cognition and the use of language. So I think if the child is non-verbal and does not relate to the words, then it's a bit difficult because our tool is the words. I have worked with Asperger's, autism, high functioning Asperger's. The children with Asperger's, they can accept it. So they seem to be able to, because their grasp of knowledge is, the language is much better. So with non-verbal children, minimally verbal, I've not really tried it much because I know the words are not, for them, it's not words, so a lot of it may be actions and things like that. So using words to get that induction, it's quite difficult. So very small children who don't really have a good grasp of language also is a little difficult. So I've not really had success there, or I haven't really tried as well. But with Asperger's, yes, those who can speak, and it has worked. And in fact, it's really, we've had a couple of patients. Myself and Dr. Rada have had a couple of patients. It was really good. And then they would come in and say, okay, take me off to space now. So, sometimes we combine, we have like a papoose. So they'd be like, get me into my astronaut suit, take me into space. So we have patients with autism with such as well. So yeah, my success, I don't think I've really tried it with non-verbal patients as well. Yeah.
Let's have a break. We have Dr. Jaswan Singh who raised a hand. Dr. Jaswan, can you unmute? Dr. Jaswan? Our regular. Dr. Jaswan, are you with us? Prof. Aisha.
May I?
Yeah.
It's a very excellent presentation. After a long time, once I was in States and I have listened this hypnosis, one a very good lecture by one of the professor in Michigan. After a long time, I have listened such a wonderful presentation. My question is that, lady, how we can give this teaching and training in our institutes? Because I am dean of one dental college, and it has really has shocked me that it is so wonderful thing that we are missing in our institutes. And what is your suggestion regarding introduction of the science in undergraduates, and especially a very separate specialty? That's my view. That what is your opinion? How to start with here in Pakistan? I will say.
Send the ticket.
Thank you so much for the question.
Yes.
For us, we've started with the postgraduates. We've started with the formal teaching for the postgraduates, because currently, although we are practicing, soon I will be joining the sort of teaching faculty of LCCH as well. But up to then, actually LCCH has that course. So our students actually go through that course. So we have sort of like an understanding with the LCCH. So our postgraduate students go there and they learn. And of course, they come back and under our supervision, they practice it. For the undergraduates, we include it in the theory under behavior management, because there's a lot of emphasis, a lot of hours given for behavior management. So it's included in the theory. And because at our faculty, we have this sort of this peers program. So the undergraduates, they come in and do, they get an opportunity to assist in the specialist clinic as well as the postgraduate clinic. So a lot of them come in there and then they witness how it is done. So, and then we get the students to do a reflective diary. So that's how we teach the students, because they come in, they observe. Sometimes they're really shocked, or they've never seen such a thing. So then they do a reflective diary based on their observation. So for undergraduate, it's in the theory as well as some observation. For the postgraduate, they get to practice it, and they are given and in their module itself, it's included in there. So at the moment, I think we are the only ones with the module incorporated. However, the other universities, usually, like I've gone to UKM, our one of our local universities as well. Usually, because we sort of share that thing, and we have some exposure for their postgraduates as well. But I think we should aim to make it as formally introduced as well. I'm waiting for AAPD to include it in their list of behavior management therapies, and I'm sure it will make the list soon. And hopefully we can come up with the syllabus as well. For the postgraduates, we have the syllabus. We will also maybe work to improve the syllabus for undergraduate.
That is excellent. That is excellent. Actually, in Pakistan, we have behavior sciences that we used to teach the students in second year. But as the compiled and very framed type of, we don't have any course. And have you in your university have the entity to introduce the foreign student as well, that we can send our students to you?
Yes, actually, we have exchange student when we have with Kurg Institute, and usually when the postgraduates come in from Kurg, we have a very special module for them, which is nitrous oxide as well as hypnosis. So there are students who have come, they've experienced both. So we have sort of a customized thing for our students. Unfortunately, the past 2 years, because of the pandemic, we've not been hosting them, but we actually have something which we've done with Cook Institute.
I can lastly, but just I like to have the comments that if there are any postgraduate workshops or like this training program, which may be on the paid basis, and patient the students can come to you for 2 weeks or 3 weeks, and they can have the practice, and they can come back to their parent country, and they will be very fruitful for us.
that's a wonderful idea, and we're working on a hypnodontic module with LCCH. I'll definitely get in touch with you once that's done.
I can add to what Dr. Anna said. Yeah, in the past we used to conduct hypnosis module before the pandemic. Yeah, when things are over, we do it as a CDE courses. We got a lot of response last time, 2 years ago when we did that program. Thank you.
Prof. Ibrahim, maybe you should just continue. We are about to end. And we have got a few more questions. I don't know whether Dr. Anna, whether the participant can probably write to Dr. Anna or write to, for the answer. There are quite a number, and I think we will.
Yeah, thank you, Datin.
Yeah, please continue. Thank you very much. Thank you, Anna.
Yeah, there's quite a number of questions still more in the chat box and also in the Q&A, but since time is running out, I put there in the email, Dr. Anna's email. Those of you, sorry Anna, I said right. Those who can't answer, maybe Dr. Anna can. You can email Dr. Anna. She will be able to respond.
I'm happy to do that. Happy.
Okay. Right. Again, on behalf of Section 15, we would like to thank Dr. Annapurny for doing a wonderful session tonight. We have about nearly 160 participants for tonight's sessions, and we hope that it is useful. And again, I also noticed that just now you put out a slide that you are like a vice president of Hypnosis. Is the Malaysian chapter or the Malaysian chapter, is it?
This one is the Malaysian chapter, but we have like Singapore in with us as well. Yeah, and we also have Asia Pacific. I know I'm on the list. I'm on the ROS for that, but that one will be confirmed later. But now it's the Malaysian chapter.
All right, congratulations Anna on that appointment. Okay, yes, as usual, we'd like to thank you, for having these sessions, and also Datin Mayuna for moderating the session. And this is the time that we are able to finish all the Q&A because a very interesting topic and many questions from Q&A. And anyway, I shared Anna's email and hope that those interested can email Anna personally and she might be able to answer. Otherwise, you can email to me. I can pass it to Anna also. Can no problem. So thank you again, and as usual.
Thank you so much, Prof.
Prof. Ashoc Malik for joining, and also I thought Dr. Jaswan want to speak just now. I let her speak, but he didn't respond. But anyway, thank you, Dr. Jaswan, for always being joining our participants. As usual, now I would like to introduce our next speaker, which is in 2 weeks' time. Okay, the speaker will talk about this topic. Is very interesting topic. Okay, the topic the title is "Come Sit in My Brain and Feel the Pain." Actually, I discussed with the speaker. I would like the topic to be more catchy, so it will pick up the interest of those who will want to see and would like to listen to it. And actually, it's based in Professor Dato Emeritus Hashim Yaakob is an oral medicine specialist at University of Malaya. He was the professor, dean, and at the time the vice chancellor at University of Malaya. And on 30th of August, he going to speak to us about "Come Sit in My Brain and Feel the Pain." It's actually orofacial pain he's going to talk about. So please join us on the 2 weeks' time to listen to this another eminent speakers, and a speaker that we have selected, and we hope that this lecture, this presentation again will be described like what we have tonight. Again, on behalf of Section 15, I would like to thank all of you for joining us in tonight's session. And again, hope to see you all in 2 weeks' time. So all the best and have a pleasant night. And again, thank you to all our participants and also the speaker and Datin and also Amy, our another committee member who's organizing this webinar. Thank you and good night. Okay, bye.